Today, we're examining a rotated mobile supine radiograph of an adult patient. The patient is intubated, with the tip of the endotracheal tube visible over the distal trachea, just above the carina. I observe a shift of the entire mediastinum, including the trachea, towards the right, indicating volume loss in the right hemithorax. This shift is accompanied by extensive pleural calcification appearing almost confluent laterally and inferiorly on the right. There's a rounded soft tissue density in the right costophrenic angle, along with smaller areas of pleural calcification on the left side. The lung parenchyma shows abnormal features consistent with bronchiectasis, particularly prominent in the lower zones on the right. There's also further opacification visible in both apices, with significant volume loss on the right. I notice a large apical cap on the right and patchy shadowing on the left, which includes both airspace and interstitial characteristics. In the left mid-zone, there's a thin vertical opacity running parallel to the thoracic wall, raising a suspicion of pneumothorax. However, since there are lung markings extending peripheral to this, a pneumothorax is unlikely. The distortion of the mediastinum and the supine position of the radiograph limit the interpretation of the mediastinal contour, but no abnormal mediastinal masses are evident. The bones appear normal. Many of these findings likely represent a long-standing process, possibly related to a past history of tuberculosis. Given the extensive calcification and fibrotic changes, understanding the patient's clinical history and reviewing any previous imaging would be beneficial. It's important to determine if there has been any progression of these fibrotic changes or new consolidation. Key points on tuberculosis. Tuberculosis, TB, can present in various ways, involving a wide range of pathologies across the body. This radiograph emphasizes the need to be familiar with the spectrum of TB manifestations, both intra- and extrathoracic. Primary TB often shows nonspecific radiographic changes, sometimes presenting as normal in up to 15% of cases. It's crucial to look specifically for a gone focus or enlarged lymph nodes, particularly in children or those with HIV. In post-primary TB, the radiographic findings typically include fibrosis, bronchiectasis, and pleural effusion. The fibrosis and bronchiectasis seen here, especially with the extensive pleural calcification, are consistent with a post-primary TB pattern. TB can also affect extrapulmonary sites, including the genitourinary system, bones, joints, and gastrointestinal tract. Understanding these findings is crucial for patient management, as TB remains a significant health issue worldwide. Proper isolation and treatment are key, especially in infectious cases. Thank you for joining me on Radiology Made Easy. Every radiograph offers a story, and I'm here to help you interpret them. Please leave your thoughts and suggestions below, and don't forget to tune in for more detailed analyses in future episodes. See you next time.